Hi everyone! Today, our group will presenting about deep friction massage. Lateral epicondylitis occurs when there is damage to the muscle and is tendon over the outer aspect of the elbow. It is caused by repetitive movement or too much strain. For instance, during sport like badminton. The symptoms include pain, weakened grip, or even swelling at the injured area. Therefore, deep friction massage can be applied to this type of condition. Deep friction massage is a connective tissue massage that was developed by James, who also known as father of orthopedic medicine. So, the mean pressure used by physiotherapists have been estimated to be 2.3 kg force per square centimeter. It may be given every day, and the treatment also will last for 10 to 15 minutes. So, what is the purpose of deep friction massage? The purpose of deep friction massage is to prevent adherent scar from forming at the lateral side of the elbow. Besides, deep friction massage also helps to maintain the mobility within the soft tissue structure of ligament, tendon, and muscle. Now, we will look into the underpin theory of deep friction massage. Friction massage will be applied at the lateral side of the elbow, and the massage will cause a transverse movement of the collagen fiber. And the transverse movement will help in preventing adhesion formation. Friction massage can also be used on areas where adhesion have already developed. This is because the friction massage also can help to mobilize the scar tissue and break the cross linkage between the connective tissue and the surrounding structure. There is a randomized control study by Zhang Minli et al. 2020 found that tapping and deep friction massage are effective treatment methods to treat patients with tennis elbow, but it is very effective when applied together. Another randomized control study by Yi et al. In 2018 found that dash score and grip strength improved in the cortisone injection group and the deep friction massage group at early follow-up. At 6-month follow-up, only patients in the deep friction massage group show improvement in all outcome measures. Randomized control study by Ali et al. In 2022 found that groups that received deep transverse friction massage show more improvement in hand grip strength, specialized and routine functional tasks, and pain reduction. There are several rules of deep friction massage. First thing first, in order to avoid injury towards the patient, the therapist should make sure that their fingers and the patient's skin move simultaneously, or in other words, move as one in the same direction. Next, to treat and smooth the scar down, the massage must be given perpendicular to the tissue fiber with sufficient deep sweep. Additionally, take note of the patient tolerance. Make sure to give friction deeply within the range of patient's pain tolerance to avoid unbearable pain. The pain might gradually diminish during the session of massage. Steps of this type of massage are not as hard as we think. Firstly, make sure that the patient is sitting in a comfortable position. Put a towel between the patient's hand and the table to add more comfort. Next, identify the location of the treatment. This can be done by doing proper evaluation, procedure, and palpation. For the tennis elbow case, which we also refer to as lateral epicondylitis case, we will identify the lateral epicondyle, which is the insertion of extensor carparadialis brevis muscle. Then, place a finger, which for this case, we prefer to use a thumb, on the identified location and apply pressure with the pad of chosen finger transversely across the fiber. After that, rub back and forth over the treatment area. Make sure the pressure given is deep enough to move the tissue back and forth firmly yet light enough to be tolerable to the patient. For precaution, we must make sure there are no open wounds around the site of the treatment. And we also must take note of the patient's pain tolerance. There might be some tolerable mild pain while having the deep friction massage, but do not press the treatment area too hard. And lastly, we must stop if pain worsens after treatment and get the medical help. For duration, it depends on the patient condition and the overall need of the intervention. Some might start with 1 to 2 minutes and progress to more time like 10 to 15 minutes. Between each session, the instructed interval is within a minimum of 48 hours. However, it depends on the patient's situation and the comparison of different intervals between the deep friction massage session does not exist. That's all from us. Thank you.